Okay, so good morning, everyone. Welcome to our virtual Walk with the Future Doc. I'm Lauren, a third-year medical student at WVU. Just going to give everyone a quick overview what to expect for the next hour. So today we're going to hear from Dr. Megan Burkhart and Dr. Sandy Burkhart to talk about how a walk a day will keep the doctor away, and then they'll be able to answer questions as we walk together virtually. So everyone should have received a little pop-up notification just to consent to the audio recording of the walk, and only the audio will be made available publicly on our YouTube channel, which is WVU Walk with the Future Doc. So thank you everyone for joining us. Now I'd like to introduce everyone to Dr. Megan Burkhart and Dr. Sandy Burkhart. And Dr. Megan Burkhart is an assistant professor of physical therapy at WVU. And Dr. Sandy Burkhart is a retired WVU professor and chairman of physical therapy. So we're excited to have them join us and speak about the topic of a walk a day will keep the doctor away. So I'll let them take it over.
Okay, so as I thought about this, I think as talking to future docs in particular, but also to anybody that wants to start exercising, is that the one thing that we do as healthcare providers that is that we kind of miss the mark with is when we tell people to become physically active, they have no idea how to do that. You tell them to start exercising, they need to exercise because they have hypertension or they're getting overweight. And the truth is, if they knew how to do it, they would have already started. They have no idea where to start, how to get there, and how to do it in a way that they're going to be successful and make long-term changes. And so with my patients, because I specialize in oncology, they are the most deconditioned patient that you can see. And so I always start with a walking program because I think it's the easiest way to be the most successful quickly in a way that feels good. And that's the most important part of starting any kind of exercise program, is that it's got to feel good. Otherwise, in order to be successful and for them to want to continue it. And so if you start to look at then what recommendations can you make? The ACSM, or the American College of Sports Medicine, has really great guidelines. But they kind of also miss the mark for people that aren't so active already or on their way to being active, and definitely not for them people that are unhealthy. And that's that their recommendation is 90 to 150 minutes of moderate to vigorous activity in a week, where 90 minutes goes to vigorous and 150 to moderate. And for most health conditions, they say to focus on moderate. I'm going to use hypertension as an example. They say that you should do for 20 to 30 minutes at a time. You should do two days of aerobic activity, 2 days of resistance training, 2 days of flexibility, and that would be yoga, Tai Chi, or Pilates. 2 days of neuromotor, meaning that you're working on your balance in some way. And if you look at that, if 2 to 3 slot recommendation, that's 12 sessions a week. So they're already asking really for 360 minutes of exercise. And that's way too much for somebody that hasn't exercised. So my recommendation for my patients is give me 3 minutes and I'll change your life. And in that 3 minutes, they just start walking. And I don't even need them to do it all at once. They do it in blocks that they can handle, that feels good. And then we slowly go up from there. The analogy that I use sometimes with patients, I stole it from my coworker, Ann Swisher, who is absolutely brilliant. She's an exercise physiologist, is that we would never prescribe, or if we consider exercise medicine, which it has a lot of the benefits of medications, but physicians would never prescribe a patient a bag full, like a Ziploc bag full of pills, and tell them, take these and you'll get better, with no instruction, with no telling them what medications they are or when to take them. But we do that with exercise a lot. So you need to be really specific. So I tell my patients no more than 3 minutes for the first week. We're going to go up to 5 minutes from there, but we're going to go up from 10 minutes from there. And the impact of 5 minutes doesn't sound like a lot, but in my world, 5 minutes of even mild to moderate walking will decrease radiation related fatigue by 50%. So 5 minutes it has a big impact. So we shouldn't ever say only and think that we're starting somebody off too small. Start small, make it happy and successful. That's the most important part, and the patients will take off from there. If we're looking for ways to get people active and, or people that aren't healthcare providers, where should you go to start exercising? The answer is there's kind of 3 categories. You can go to athletic training and to a personal trainer, but those 2 things should only happen for a very healthy individual or an athlete. And honestly, those are people that usually know how to exercise, and we're not really making these recommendations for. But athletic trainers should only be seeing healthy athletes. Personal trainers should only be seeing anybody that's healthy to begin with. The next step up is if you have an unhealthy individual, you want to use an exercise physiologist because they understand the different changes in the body that happen with disease processes and can do things safely. So anybody that you're uncomfortable with them exercising by themselves would also be a good category for that. And the final is when to send to a physical therapist, and that's if they're like severely deconditioned, very ill, have pain, or have some kind of movement restriction or dysfunction. And if you're really worried about the patient that's deconditioned, then a PT can handle, anything from cardio rehab, rehab on up. So that's my point, is to just make sure that we're making not just the blanket recommendation for somebody to be active without making sure they know how, and to start slow, happy, and make it successful. Now, my dad is going to talk to you about ways that we can all improve our walking, or suggest that we improve their walking with patients to make us more efficient, to be lifelong walkers. You still there, Dad? Otto. Okay, I think we may have lost him. Dad, you ready?
Yeah, you were cutting
Okay.
out. Am I okay?
You're okay, go on.
All right. Good morning from sunny Florida. The weather is gorgeous here, but my West Virginia flag flies high above the house. So we're true mountaineers. How many people are walking right now? Most of them are walking, or can you hear me? Testing.
Yeah, everybody's muted mostly, Dad. So I think as I flip through the pictures, most everybody is walking, either outside or on treadmills.
Okay.
Everybody seems to have a wiggle on.
All right. Okay, great. Okay. Well, I think I'm a walking kind of guy. I walk every day. So I'm very interested in the mechanics of walking, and I train debilitated patients who start from zero, and we figure out ways by which we can make walking efficient and easy for them. If we're going to send them to a gym, they won't go. They won't spend the money, and they don't want to be seen around all those fit people. And so the aspect is they have to be able to do everything in their house, and they need to do it without equipment. They don't need any equipment to do what I need for them to do in order to get started on a walking program. And so there are a number of things that we have to do, and that is to get them motivated. And I'm my own motivator because I had triple bypass and a valve replacement. I fell and had a head injury. I'm insulin diabetic. I have kidney disease. I had prostate cancer. I had to have a pacemaker put in, and that's a pretty sad scenario. But as of today, since November 1st, 2015, I've walked over 20 million steps, 9,000 miles. In this process, I walk every day. I use my Apple Watch as my moderator. So I walk the walk. And so when I'm with them and say, look, I started where you are, this is where you can go. But you have to start out easy, and you have to follow my instructions. And I'm going to be on your case because there's accountability. And that accountability means that you have to be able to do it. I'm your personal coach. So many of my patients are on my iPhone, on my sharing. And so I know what they're doing every day, how many steps they're doing, how far they're going, and how often they do it. And one of my Parkinson patients stopped for 5-6 days. And I called him on the phone. I said, "What's up?" He said, "Oh, my brother died and I'm a little bit depressed. So I stopped." I said, "Get going, get back on your road because you need to get moving now. Your brother wants you to do that." Relatively easy about yourself. So when standing tall and your center of gravity is under control, you move more efficiently. And so we want to try a couple of things here. For those who are on a treadmill, you'd have to stop the treadmill. And all I want you to do is stand with your weight of both feet. And I want you to slump in your posture. And then when you slump down, you're kind of looking at the ground in front of you. And now bring your chest up slowly and your eyes go on the horizon. So you're going from a slump position and up to a taller position. And that's extremely important. So let me tell you why. What I want you to do is to stand up as tall as you can. And I want you to raise both arms above your head, all the way up. Megan, get their wallets. Okay, now bring your arms down. Okay, now lift your arms up again above your head. See how far your arms go up. Okay, put them down. Now slump. Bring your chest down and slump. Now try and lift your arms up. Your arms are heavier and you've lost your range of motion. So that's extremely important because if you walk in a slump position, you decrease your strength by about 25%. In other words, you have hidden strength within your body that you can use if you just bring your chest up and feel that. Okay, now relax. Now what I want you to do is take a deep breath and raise your arms above your head as you do it. Take a deep breath, raise your arms and bring it down. And breathe in again, raise your arms and bring it down. This time when you go up, sense how much air you're putting in your chest as you raise your chest up and then down. Now slump. Now try and take a deep breath. Not so easy. It's difficult because your diaphragm is sitting down against your viscera. So it can't move. So you have to take your breath in from your upper chest. Now imagine walking in that position, you're going to fatigue very quickly. Very, very quickly. And once you start to fatigue, guess what? They stop. So breathe in, put your arms up, take a deep breath, and you can see your chest comes up, your diaphragm rises above your viscera. And now you're in a position where you can use your diaphragm to bring more air into your lungs, to bring more oxygen into the system, and to give you more ability to move. That's extremely important. Now, we could do the same thing with walking. So you can turn your treadmills back on. Okay, and those that are walking now, stand up tall. And I want you to walk about 20, 25 feet. But when you're walking, I want you to sense your feet. Think about what your feet are doing when they hit the ground, on the ground and off the ground as you're walking. And sense how heavy your feet are. There's no numerical weight to your feet. So it's just an idea, an abstract idea of what your feet weigh. And so go ahead and walk that 25 feet as I am right now and feel you're walking. Okay, now stop. Now, as you stop now, I want you to slump like you did before. Just bring your chest down to the front of you. Your feet are still, and now walk. And you might notice that your feet are heavier, that your stride is shorter, and it's not so easy. So if you take your hand on the top of your chest and push your chest up, so you get back into that good position, you'll see that your feet get lighter again. it gets easier. Your pulse rate won't go up. You won't start to breathe heavy, and you can walk more efficiently. The other thing with this that's extremely important is that when you're in the upright position, if you watch somebody walk or even yourself, you'll notice that your arms swing naturally along your side. You have that normal rhythm of walking. If you now bring your chest down in that position and you walk,
Oh no, I think we lost him because I saw
Okay.
his
Let me
his
call him and let him know because
iPhone
I bet
left.
you there he is. Dad, you're muted. Can you unmute yourself?
okay, can you hear me now?
Yeah, yep, there he's back.
Okay, where was I when I got muted?
Lifting your hand, your chest up with your hand.
Okay, and if you lift your chest up, then your arms will swing normally without you ever thinking about it. So when I watch somebody walk and I see that their arms aren't moving, I automatically know that their chest is in the wrong position and they're in the down flex position. They have decreased strength, they'll have decreased endurance, and they certainly have a good reason for stopping. So I actually walk with them outside in an open space in order to get them to move efficiently so they know what that is. Then, as Megan said, there's a walking program that they need to go on. They don't need to do 10. They can start with 10 minutes 3 times a week, and then they can do that for 2 weeks, and then they can increase it by 5 minutes. So by the end of 6 weeks, they're walking well over a mile and enjoying it. Also, when they're walking, it's important that they look at the scenery. It's important that they not walk in the same way each time. When I walk every day, I go a different direction. I never use the same route twice. So I will go back to the route later on, but I'm always looking at different ways to vary my gait and my performance. So they have to learn how to do that, and they can only do that if I'm with them. I say, can you do this? Can you do that? How does it feel if you do that? How do you feel if you do this? And then they get the awareness of where they need to be and how to be efficient when they're walking. I lose very few people in this process. They really learn how to do it, and they learn how to do it efficiently. So when you're talking about telling people to walk, they won't do it because it's simply too difficult. They're in the wrong positions. If you take time out and create the walking spirit in them and create the efficiency in walking, then they can learn to do it and they can enjoy walking for their health. Okay, thanks.
Awesome. Thank you so much, Megan and Sandy, for starting us off with a great topic today. My name is Mia, and I'm a second-year medical student at WVU, and I'm helping coordinate this Walk with a Doc program. We're going to open it up for questions for the rest of the hour. So if anybody has any questions for the Burkarts, you can go ahead and unmute yourself and ask it out loud, or you can send a message in the chat, and you can send it to me. And again, my name is Mia, or you can send it to everybody, and we'll make sure that your question is heard. So I will start, Megan or Sandy, off with a question. I kind of wanted to know what kind of equipment do people need if they want to get started walking, or what do they need if they want to get started with a change in their life?
A good pair of shoes.
Okay.
Cheapest gym equipment
Yeah,
you can get. is a good pair of shoes. No, really, for walking, that's all you need. It's great if they can get a heart rate monitor or step counter. You know, in West Virginia, that's a little bit tough for some patients. But smart watches are great for feedback, especially for inactivity. But really all you need to do to start a walking program is have a great pair of sneakers.
That's what I love about walking, because it's so easy. Just have them buy the shoes.
Yeah, the other thing, I mean, what they do in the house is extremely important. From my standpoint, there are no exercises that you can give them that will improve their walking, except walking. I mean, the exercises are specific biomechanically to the exercise, the weights, the resistance. If they have to go to a gym to do it, they can do their gym exercises. But if they leave the gym and they go back in that slump posture when they go home, you don't gain anything. So their home protein equipment in the house when they're starting this, they need to do sit to stands where there are tests for sit to stands, how many they can do in 30 seconds. But they got to get up every hour and they do their sit to stands in a chair that's the normal height, and they do 10. And they're going to build those sit to stand exercises with their own body weight. That's their equipment. And they're going to strengthen their legs just with the sit to stand motions. They can do wall push-ups. They don't have to get down on the floor to do a push-up, because if they try, it's too difficult to get up and down. So teach them how to do a wall push-up or a counter push-up, anything that works their back muscles in a way by which they pull their center of gravity upward. I mean, those are really two important exercises, and they can do it many times during the day. If you're on the Apple Watch system, it asks you how many times a day you stand up. My watch asks me to do 12 a day. I do all 12 a day. Every time I get up, every hour, I do my sit to stands. And then I do them with speed. And so the aspect, if I sit down and get up and down, I can do probably 18, 19, 20 sit to stands in 30 seconds. That's pretty rapid. And that's all body weight movement. I do not use any resistance bands. I do not use any kind of weights or anything else. I simply use my own body weight in ways that can be creative.
I'll say that I don't know that you'll find any evidence of this, but I think my dad would agree clinically. So when we see a patient lose their ability to do a sit to stand, their ability to walk is right behind it. So that they're gonna, the same muscles that are needed for that sit to stand are needed for them to be able to functionally ambulate. So if you see a patient that is having trouble and you're getting up and down, it's a great time to intervene before they lose the ability to ambulate.
Can you hear me?
Did someone have a question? Otherwise, there's one in the chat.
I just wanted to ask what they tell people about weather. We don't all have the luxury of being in sunny Florida.
So living here in Morgantown, I tell people, again, it's my patients are mostly immunocompromised, so I have to be a little bit careful, but the old mall, it's a half a mile lap around the inside of the old mall. You can get quite a boogie around the outside loop of Sam's Club if you go there early enough that there's not a lot of people. Barnes and Noble, that's also another great one. Walmart's a great one, especially if you have somebody that's really deconditioned. The nice thing about those places is there's seating so that they can get up and walk for 2 or 3 minutes, come and sit back down, rest, get up and do it again. And nobody really will blink an eye at it. So it's a great way to do nice, flat, weather-controlled walking.
Do you have any guidance for older people with respect to using treadmills and maybe like balance or fall risk with that?
Okay. Yeah, I think I'll answer that one, Megan. The treadmill is the most dangerous exercise piece of equipment for an older person, because if they lose their balance and they don't wear the switch that turns it off, the treadmill will throw them. And when they throw them, they're going to get serious injuries, including head injuries. I don't recommend that older people go on a treadmill. They can hold on to the side of the treadmill, but they have to put on the safety switch in order to prevent themselves if something happens. And so the treadmill is different than walking outside. The treadmill, their hands are on the bar. There's no arm swing when they do it. As an alternative, it's okay, but it's not a substitute for walking outside free with your arms in the position that they can swing.
Also, I really like the new step. And we have one in the clinic. They have one down in the HPL. It is not like, it's not weight bearing walking, but at least it's using some of the muscles of gait. I have found great success in being able to exercise people that can't breathe on the new step in ways that I can't do it with them standing initially. So that's a really good, safe option, because treadmills, same with me, they scare the shit out of me. I don't want anybody on them that they have to walk incredibly slowly if they don't have balance, and to the point that they're not getting any benefit from it.
Yeah, there's a special treadmill out there that we have in our clinic here in Boca, and it's a big airbag that goes around the person. The person puts on a special pair of pants and they're zipped in, and we fill the airbag with air, and it takes their body weight off. We can reduce their body weight by 50%. So if you weigh 100 pounds, we can make you weigh 50 pounds, and you're secured in that bag in a zip aspect, and you're able to walk with easier components. It gives them a chance for the brain to pick up the normal aspect of the gait, and when they're in a minimally loaded position, and it allows them to walk closer distances, and it's absolutely safe. They can't fall. And so that's a tremendous piece of equipment that we use with many types of patients who are injured.
Thank you.
Okay, I have a couple questions in the chat that I'm going to read. So the first one is, this person said, I tend to do the same route. So if something bad should occur, someone knows about where I am. What do you think about that?
Well, the iPhones have trackers, so that when I'm in Germany with Jennifer and Jorg and Quinn, they can actually track where I am. And so that's a nice feature. If that's an issue of safety, then I think it's important to stay on the same route, and always let people know where you are and where you're going and what time you're going to be back.
I agree. The increased safety of staying on the same route is going to be more important than varying up the scenery. Unless you can take somebody with you, then I would stick to the same route.
All right, and then another question was, how do you motivate people to walk when they used to be very active, like formal athletes, but have gained a lot of weight and are now very limited? They seem to see this as a failure.
I hit this a lot. So I worked in a hospital on an oncology unit before I came to WVU, and people will tell you, they'll compare where they were before to where they are now. So I used to be able to walk 2 miles, and now I can't walk 50 feet. And I make a really big deal about the fact that they walked 50 feet, because today you walked 50 feet, but yesterday you did nothing. So we are at a huge improvement with 50 feet. If you go 500 and, in 3 days, then we're doing absolutely fantastic. And it's all about how you change their language, and and the way that they think about it, because same with chronic pain, we allow people to sit with these kind of negative thoughts about their pain limiting them, and their, debility limiting them, or the deconditioning. And really my favorite thing to say is, what I see in you is a whole lot of hope. There is a whole lot of hope because I see so many things that I can make better, and that you can get better. We just have to start slowly, and we have to slowly build on it. And when you kind of change that language to, what you really got to, you've got a whole lot here to work with, it makes people kind of change the way that they see their own potential.
Suggest like we would want to suggest the exercise physiologist, but they don't live in town where we have the HPL. What are the best options? Of course I've sent them to physical therapy, but I don't know where you generally find exercise physiologists.
Well, if you don't know where there's an exercise physiologist, send them to a PT. PTs can do the same things. You just want to be pretty broad in how you write the prescription, so that you're not giving them one thing to focus on, because some of the newer grads love to focus on, okay, you're sending me a patient for hip pain, I'm only going to look at the hip. So you want to put in there that you're sending them for maybe hip pain and balance and deconditioning, so that they have within their scope, like within the scope of that prescription, more to do. The other thing that's always an option is the HPL, which is run by our exercise physiology faculty, will do home programs, so that a patient can come to them and get an assessment and get an exercise program, and then they can, for one, to do in the house, and then they can, if they're coming up to see you, then when they come up to see you, then they go to the HPL to get their exercise program updated.
Megan, could you talk a little bit more about what an exercise prescription looks like?
Yeah, it's, do you mean like what you actually will tell the patient to do, or where you're sending them to?
Yeah, a little bit of both.
Okay. For me, it's a very set, it's a very kind of strict set of exercises and aerobic activity. I don't tend to give my patients more than 3 exercises at a time, because then they just won't do them. I always up my frequency in order to get what I want. So if I want somebody to do their exercises once a day, I tell them twice a day. I tell them once a day, it usually means I want it every other day. But they're very specific. It's not just that I tell them to do it, but I watch them do it to make sure that they're doing a good technique. And it gives them something specific to focus on. The exercise, or for walking, is the same. Is I will walk with them and we'll set a pace that I can see that they're okay with. In the beginning, when I talk about intensities, because people don't really understand what like mild, moderate, and vigorous intensities are, is that mild is that you can walk and have a gossipy conversation. There's no trouble having a good talk while you're walking. Moderate activity is that you're walking fast enough that you feel your heart rate's up and that your breathing is a little bit increased and you're having trouble having a conversation. And vigorous is there's no way in heck you're going to be talking to anybody because you think you're going to die. So that's my way of describing things. I tend to be pretty funny with my patients because everything else in their life is pretty serious. So I don't like to be too serious. So, I want to make sure that it's incorporated into their life to increase their activity, but not too much that they won't actually do it. When I work a lot with the HPL, I'm very grateful to have the exercise physiologist down there because I can then stay involved remotely with the recommendations of just body parts that I think are weak and need to be helped. So I make the initial recommendations off the exercise, and then they go from there. They see something they don't like, they call me, I run down, and I make a change. So does that kind of help?
Yes, thank you.
Okay, perfect. I'm really excited because I didn't know this, but my neighbor has chickens. So thanks to you guys doing this walk, I now know that my neighbor has chickens. I'm really excited.
Okay, now I had to unmute. There's a test called the 6-minute walk test. It's how far you can walk in 6 minutes. And so if you have a way of them determining a distance, so how far they can walk, and they don't have to walk the 6 minutes, because if they get tired or whatever it may be, you can turn it into a 3-minute walk test. And that's their starting point. So as you start to change their efficiency in their walking, in a week or so, they can repeat that same test and they will always walk further. And so the 6-minute walk test becomes a very important, simple test that they can do themselves to see how far they're going in a period of time. And it's kind of a motivator too, but I don't want them to push through it. I only do this, they only do the 6-minute walk test when I'm with them. And then I make sure that they improve their efficiency. And then we look at the time and the distance from the previous test, and they can see their improvement, and it improves quite dramatically.
A neat trick that I learned from treating chronic pain, or it was a recommendation at one of my chronic pain CEs, was that you ask a patient for a goal that they're 80% sure that they're going to be successful at. So if you, especially with pain or deconditioning, like I'm 80% sure in 2 weeks that I should be able to walk twice the distance that I did today. And that's a really great way of setting successful goals. But the patient will also usually self-select something that is very important to them, so that you know that they're more motivated to do it if they see that they're making an improvement in something that matters.
Can I say something about back pain? Can you hear me?
Yeah, we can hear you.
Okay. Having traveled in third world countries, many third world countries, one of the interesting things about third world is that back pain doesn't exist in the third world. They don't have it. They don't experience it. Back pain in our Western countries is because of sedentary activities and a loss of control. And the reason that the more primitive people don't have back pain is the bathroom, and their only needs of transportation are their shoes, their feet. So they maintain their pelvic control and their back muscle control with walking, balancing, and squatting. And therefore they never develop back pain. That's actually been documented. So in North America, when we have people with back pain, they normally have a real deficiency in the deep spinal muscles, and those muscles have to be turned on, and then they have to be turned on during functional activities. And if you turn those muscles on during functional activities, their back pain diminishes dramatically.
Sandy, I do have a question for you because you talked a little bit about back pain and posture. I have seen those pieces of equipment that you can like strap onto your shoulders and they help with your posture. I was wondering what you thought of those, if you thought they were helpful or what your opinion is.
Well, you saw many years ago, they would put a belt around waste of workers at Home Depot and other places to prevent back pain. Okay, so those were around. They got a lot of play. But when they put the belts on for a period of time, the muscles stop working. So they're okay if they're wearing the belt, but as soon as they take the belt off and the back muscles aren't working, they're more vulnerable to injury. So the same is true with those shoulder straps that pull the shoulders back. They pull them back and put them in a passive position, but as soon as the patient takes it off, they automatically begin to slump and go forward. So you need to be able to correct that without those supports. They may be helpful initially to decrease the pain so we can do a little bit more, but as a permanent device that they're going to use the rest of their life, it won't work.
I prefer to use a single piece of Kinesio tape across the shoulder blades. It's enough that I set it to where I kind of put them towards neutral, but that when they start to come back forward, then the tape starts to pull a little bit, and gives them some kinesthetic awareness that they've come out of the good, like the more neutral posture or whatever posture I pick. And then they have to actively come back to that posture so that they're firing the muscles that they need to improve that posture. I much prefer that to a device that's going to hold them, which is, again, it's anything passive is not going to be the best thing to do. Active is best.
Thanks. So we're getting close to the end of the hour. If anybody has any more questions, go ahead and unmute yourself and ask it out loud, or you can ask it in the chat.
I'll just say thank you for speaking. I've known the Burkarts for my whole life, and they're awesome and always up for doing things like this. So really appreciate you both participating.
Thank you, Laura.
I was really excited to do this because this is the first time my dad and I have presented together. So I think it's really kind of super cool that we did it in this way and we did it for Laura. So I appreciate the invitation.
And just so you know, there's always, Wi-Fi issues and cell service issues at these talks pretty regularly. It's not a big deal. These are pretty laid back, so I wouldn't worry about anything like that.
Yes, absolutely. We so appreciate your time, and I really value this talk today. I think it's different than some of the talks we've had lately. I love the exercises that we did. I didn't realize how much my posture affected my walking, but thank you for pointing that out. Sandy and Megan, if you could give us like 3 takeaways from your talk today for people that are listening, what would you say?
Take a walk a day to keep the doctor away. Megan?
I would say any patient, you just set them up to be successful. You would do it with any other, like medication and how to use medication. So set them up to exercise in a way that's going to be successful as well. If it's not getting them help, then at least giving them pretty good guidelines on where to start.
Yeah, and I think that developing kind of YouTube exercises for the home are extremely important, especially the sit to stand things they look at, things they can get off the computer because most of them will have digital access. And so if you prescribe exercises that when they go home, they can look at it and remember it, because remembering the exercises from the clinic to home is not so easy for some people. But if they can see it again and they can repeat it, I think that's an excellent way of motivating them to do it.
Yeah, I think the other maybe just to, walk the walk and talk the talk. We've all had moments in our lives where we haven't done what we could do, that, we were hurt or our posture was not great. And relaying that to a patient and telling them that starting with this slow progression is normal. And I like this with pain as well, is to say you're not alone, and we can do this together and we'll get you through it. Is such an important thing, because then they feel like they're part of a team, and they feel like that they want to do this not only for themselves, but to improve for you, to show you what they can do.
Yeah, I think giving them feedback by phone or text is really important for the patients I have. They all have my telephone number. And after they start on the program, then I call them on the phone and I ask them what was good about it, what was bad about it, how they can improve it, and give them a little bit of feedback. That way, that's extremely helpful. And they know that I care about them and that I want them to be successful.
Okay, great. Thank you so much to the Burkarts for joining us today. Thank you for your talk. Thanks to everyone who joined in. We are trying to see how far our program reaches. So if you're still on the call with us now, if you would go ahead and open up the chat and type who you are and where you're walking from. We're just trying to see how far this program is making it. And our walk today will be audio recorded and posted to our YouTube channel. So if anyone knows anybody who thinks they could benefit from this talk, encourage them to listen to it and go for a walk, 60 minutes like we did today. Thank you all so much for starting your Saturday off right with us. We so appreciate seeing you and your faces. I love seeing sunny Florida today from rainy Morgantown. So thanks so much everyone for joining us. Our next walk will be in 2 weeks, and you can check out our Facebook page for updates on who will be talking. But it'll be 9 a.m. Saturday morning as usual. So thanks so much, everyone.